At one of the nation's largest VA medical centers in Washington, D.C., officials knew of staggering problems for years but did not fix them, according to a new report from the Office of Inspector General. Patients put under anesthesia before doctors realized they didn't have the right equipment for surgeries. In some cases, staff ran across the street to a private hospital to borrow supplies.
Clearly, lives were put at risk, and that's why it's important that we deal with this on an urgent basis.
The report revealing waste on a stunning scale. Over 3 years, the medical center rented in-home hospital beds for 3 patients for $877,000 when it could have bought the 3 beds for $21,000. Investigators discovered a culture of complacency among VA leaders. VA Secretary David Shulkin told them he did not recall being told of the problems. Today, he called the findings unacceptable.
This, to me, represents a failure of the VA system at every level.
Investigators did not find evidence of direct patient harm, but veterans were put at risk. James Preston of Maryland, who says he's undergone cancer treatments there since 2002.
When I walk through that door, there's an expectation that I had that I'm going to receive professional medical care.
In response to the investigation, the VA says it's bought more than $3 million worth of surgical instruments and is trying to improve its accountability following the latest in a string of scandals. Gabe Gutierrez, NBC News.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.